Couple of days back, a student has sent me a message saying that I am going to start my internship and I wanted to utilize the time available during internship for entrance preparation so that I wanted to crack the exam in the first attempt. I've been a regular student from your pre-foundation, foundation. I've done a little bit of good reading as well. So what do I do now? So this has been a burning question for almost every batch of interns who enter into their internship. That say, I want to read well, I want to utilize the time well. They start on a very high positive note. Over the period of time, the work takes over everything, and the studies kind of reduces little bit, gradually day by day. So here we are going to strategize what you're going to do in internship and how to utilize the time available for you in the best possible way so that you may give a very honest attempt at the end of internship. If you're new to this channel, I'm Dr. Anjit and consultant pathologist in the faculty of pathology for various competitive exams. Subscribe to this channel and click the bell icon, and we will discuss lots of things about how to improve ourselves in your academic platform as well as in other ways as well. Now coming back to the question again. So what do I do during internship? If you ask me, I would say the best time to read or best time to prepare is during internship. There are various reasons for that. The first being, you must have had a fair knowledge of all the subjects in your first year, second year, final year, and your pre-final year as well. The second and the most important thing is you are seeing patients. You handle patients, you manage patients, you write the investigation for patients, you write the case sheet for patients, you prescribe for patients as well, and you do procedures as well during internship. So this is the best possible time to read. But unfortunately, the amount of free time to spend with books is less. With patients is more. And I would say that's a blessing in disguise. We don't know that it is a blessing, that's all. So what you're going to do in internship is this. For every intern listening to this video, I want you to try this at least for 2 weeks sincerely. Please don't try for one day and say that it's not working. Nothing works in a day. 2 weeks, 4 weeks, best. It will definitely work. Let's take an example of that. Let's assume that you are in an emergency duty in a casualty posting. So when you're sitting in a casualty posting, let's say an entire duty, you will see lots of cases, lots and lots of cases, emergencies, not so much of emergency. You handle them, you triage them, you send to different departments. So in that place, I want you to take a notepad every day to your internship, a tiny notepad where you're just going to write key points. Every day, the key point is going to be based on these things. 2 major cases, 2 minor cases, and maybe few syndromes. This is your plan for every day during internship, just 5 things. So what do I mean by 2 major cases? Let's assume you're sitting in a casualty and a patient comes to you with, let's say, myocardial infarction. You look at the patient comes with chest pain, you ask for an ECG, you go and look at the ECG, you see an STT wave elevation, you send the patient to your, stabilize the patient initially, and maybe then send to your cardiac care unit if your hospital has that, right? So this is a major patient. I want you to write myocardial infarction and little bit about the case history of the patient as well. 40-year-old person came with a chest pain, that also should be there. This is very important. Don't just write the topic alone, write the patient which you saw. See, because you've seen, you've managed the patient, that is going to be there in your head forever. It's your patient, not a textbook patient, not an MCQ patient. So on top of this patient, we are going to add more informations, theoretical informations, MCQs going back to home or your hostel, right? So if this is the first patient, you write down myocardial infarction, brief history of the patient, you go back to your hostel. At the end of the day, maybe you will have definitely at least 2.5 hours of spare time to read with your books. So in this 2 hours time, I want you to keep like 45 minutes for the one long case, the big case like myocardial infarction, 45 minutes for the other. Of the 30 minutes, 10 minutes for your one small case, 10 minutes for another small case, and last 10 minutes I'll say you what to do. So in this 2 hours, go back to your textbooks, open all the textbooks you have, right from your first year to final year. See, this is a very important point, vertical integration. You're seeing a patient with MI. So what you're going to do is little bit about cardiac anatomy. Embryology is not so important in MI, but anatomy, the vascular supply is important in MI. You're going to read a little bit about that. Little bit about EKG features. Little bit about the clinical symptom of chest pain. Little bit about the pathogenesis, the post-mortem infarct appearance in pathology, cardiac enzymes, the changes, which comes first, which comes later. Then how did you manage? If you're given a treatment, is there any guidelines for the treatment, the dose for the treatment, everything. Everything from the first year till the final year, vertically integrate for 45 minutes. It will consume time. I'm sure it will consume time, but you are reading for your patient. So you'll definitely remember that. Do this for 2 long cases per day. Let's say the first case for today was myocardial infarction. Let the second case be appendicitis. Great. Fine. So this for 2 long cases you did, and same way for 2 more smaller cases. Smaller case in the sense, let's take a dog bite. So you're going to just spend some 10 minutes on rabies vaccination, what to do, when to do, post exposure, the anti-immunoglobulin, when to give, the dosage, the site, everything regarding that. So you've done 2 long cases, you've done 2 short cases. So as in our schedule, we have 10 more minutes left. So see, these 10 minutes are for the exotic questions which comes there. For example, what I mean by that is, it's hard for us to see a Dressler syndrome post myocardial infarction. It's not so common. So that is more theoretical. You will see definitely MI, Dressler syndrome, bit rare. Right? Sakasubo cardiomyopathy, bit rare. So these syndromes, these exotic questions is what you're going to write down in a separate notebook in the next 10 minutes. Write these down, don't read. When you write these down, you are also catering for the difficult or rare scenarios, rare syndromes, signs, everything in a notebook which is handwritten by you. End of a month or end of 2 months, keep revising them so that you take care of that part of the exam as well, right? So if you do this for, let's say, 10 days, you must have covered 20 long cases, 20 major diseases, 20 minor diseases. The best thing about this is you have covered myocardial infarction, let's say in your a casualty posting. You go back to your medicine posting, you again see a case of MI. I am sure 100% your brain will automatically revise whatever you read during your casualty and you will implement that. Implementation is the key here. I am not just reading from a textbook, I am reading and implementing. It will never get out of your head. That's the way to read during internship. Do this consistently. Do this again and again. Do the entire internship. I am sure you will crack it. You'll definitely have a much better approach to medicine. That's more important than your NEET exam. You'll have much more clarity on thought of implementation of when to give a diagnostic test, when to intervene, everything. You'll become a very good clinician, a very good diagnostician. That will be more important for me than your entrance exam. And obviously in your entrance exam also, with the integrated pattern of questions, your approach will be faster, quicker. You don't spend much time beating around the bush in a long stem question, right? So this is what I wanted to discuss here. And in this video, we didn't have face, it's just an audio because I'm trying something out in my YouTube platforms because last time the audio was not so good. One of the students suggested to get a Rode mic. I've got a Rode mic and I'm trying out the audio. I don't have a soundproof room yet. I'll improve it. I'll improve for sure. Maybe the next time I'll make it much more clearer, much more better. I just want you to comment on how the audio is compared to the last video. If the audio is better, okay, I'm on the right track so that it helps me to improve as well. Thank you for your time. See you soon again in another video discussing another concern of yours. Till then, bye-bye from Dr. Ranjit. Bye-bye.